Edutainment Studios welcomes you to Controlling Blood Sugar, Preventing Complications. This module is part 3 of a 4-part series on controlling blood sugar levels and is intended to help you understand what are the treatments and complications of high and low blood sugar levels. The average blood sugar rises gradually, and as it rises to abnormal levels and stays there due to a system dysfunction, there is damage occurring throughout the body. Out-of-control blood sugar levels can lead to serious short-term problems such as hypoglycemia, hyperglycemia, or diabetic ketoacidosis. In the long run, uncontrolled blood sugar can also damage the vessels that supply blood to important organs like the heart, kidneys, eyes, and nerves. This can occur even when one feels okay. That is why it is so important to take action as soon as one is diagnosed with diabetes. Our bodies are amazing, but unfortunately, once we have a heart attack or stroke, or our kidneys fail, or we become blind, the damage can't be undone. In this course, the objective is to help you know what are the treatment options for controlling your blood sugar, what are the possible complications of having high and low blood sugar levels. There is no cure for diabetes, but your treatment plan can help keep your blood sugar on track and prevent complications. Your doctor may suggest medicine or insulin. Your doctor may suggest oral medications if your pancreas can still make some insulin. There are different classes of medicines, and there is usually more than one medicine in each class. Each of these medicines works in a different way, and what works best for one patient may not work for someone else. Diabetes medicines work by helping the pancreas make more insulin, helping insulin in your body work better, decreasing the amount of sugar the liver makes, blocking the breakdown of starches so they cannot be turned into sugar, preventing the breakdown of hormones that help lower blood sugar, and/or preventing the kidneys from reabsorbing sugar. As your body's ability to make insulin changes, you may need to switch or take a combination of medicines from different classes to help lower your blood sugar. You will need insulin if your pancreas cannot make it or cannot make enough. One cannot take insulin by mouth because the stomach acid would break it down before it got to the cells. One must inject it with a syringe and needle, pen, or pump. There are fast and long-acting insulin options. Your doctor will recommend the best type for you. If your diabetes is not controlled, it can begin to affect other organs and parts of your body over time. These complications of diabetes usually come on slowly. You can prevent or delay complications by following your treatment plan and keeping your blood sugar and A1C close to goal. If you smoke, quitting can also help. Now, let us take a look at the most common complications and what can be done to help prevent them or catch them early. Having high blood pressure and/or high cholesterol increases your risk of a heart attack, stroke, and other diseases. You should have your blood pressure checked every visit, and have your cholesterol checked at least once a year. If your numbers are too high, your doctor can prescribe medicine or recommend lifestyle changes to help. High blood sugar over many years can damage the kidneys and cause them to not work well or stop working completely. You need to ask your doctor about screening for kidney damage. If you are at risk, medicines and diet changes can help. Having high blood sugar over long periods of time can damage the nerves and cause neuropathy. There are different types of nerve damage, but the most common happens in the legs and feet and is called peripheral neuropathy. If you have symptoms, they can include pain, sensitivity, numbness, and weakness. If you have lost feeling in your feet, you could injure yourself and not notice. You need to ask your doctor how you should care for your feet and report any changes right away. You also need to have your doctor examine your feet at each visit. Poorly controlled diabetes increases your risk of several eye-related conditions, including glaucoma, cataracts, and retinopathy. You need to schedule yearly visits with your eye doctor to spot changes early so they can treat them. Because having diabetes and high blood sugars puts you more at risk for bacterial infections, this means your gum health can also suffer. Daily brushing and flossing are important, but you also need to visit your dentist twice a year for cleanings and checkups. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for Part 3 of this 4-part series on controlling your blood sugar levels. Please let us know how we did by completing the survey. If you have any suggestions or questions, please send them to us via the survey and come back for Part 4.